Hi, this is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the global pandemic as it's impacting the United States as of August 30th, 2020. As we've said before, the pandemic was relatively unknown in the U.S. until early March, and then it began to grow rather rapidly. It's been growing consistently every week since then. This is total number of deaths. And this week we have passed 185,000, so we have almost 187,000 deaths and over 6 million confirmed cases. And we've seen about a 3.7% increase in the total number of deaths in the past week. Now, as I've mentioned before, around the world we're seeing different patterns, where there's some countries where it's growing quite quickly, others where it's starting to level off. In the most advanced countries, the countries that have been most heavily impacted in terms of deaths per million, we see this consistent pattern where it's leveling off after rapid growth. And the same is true in the most heavily impacted states in the United States. So we begin to think that this may be the pattern. This may be what a mature pandemic looks like, that after rapid growth, it'll eventually level off. If you look at it another way, in terms of week-to-week percent increase in the total number of deaths in Belgium, for example, which was until this week the most heavily impacted country in the world in terms of deaths per million. Early on, they were more than doubling every week, 100% growth rate. And then it has been coming down and approaching zero. They still have more deaths, but it's nothing like the early growth rate. The U.S., we're seeing a similar pattern. It's coming down and it seems to be leveling off, but it's not quite at zero. It's about 3.7%. That means we've had 3.7% more deaths this week than we had last week in terms of cumulative number of deaths. And this is because in the U.S., as around the world, there are different states where it is evolving a different way, in different patterns. This is not picking on Florida or Tennessee or Virginia. It's simply saying that in Florida, the pandemic is earlier. It is exploding. Tennessee is maybe a little bit later, and so on. And then states like New York are leveling off. So hopefully we're going to be moving in the direction of seeing the leveling off everywhere. But at this point, we're still seeing considerable growth in the pandemic in our country. If you look at total number of cases early on, it grew rapidly, then it slowed down, then it grew again, and it's coming back down. And many folks are taking some comfort from the fact that it's coming down. That may be true, but again, just to remind people that these numbers are still higher than they have been for much of the history of the pandemic in the States. And as I've always said, I'm not a big fan of using cases because it's very dependent on the number of tests that you do. If you look at deaths, we had an explosion early on, then it came back down, then it came back up again. And perhaps it's coming down, but again, we're still seeing more daily deaths than we've seen at any time since the beginning of June. I always like to remind us, because there are still some people who question whether COVID-19 is an important disease. In the United States, the top 10 causes of death account for about 3/4 of all the deaths. And if you estimate the number of deaths that we would expect in 8 months, since we've just completed August, we have had 8 months in the United States. This is the number of deaths that we would expect from the 10 leading causes of death. And COVID-19 would be right there solidly in third place. If you look at a map of the United States, this is all of the cases since the pandemic began. And you can see them tend to be clustered in urban areas. Now I'm going to transition to the cases in the past 2 weeks, and you'll start to see spreading into new areas, particularly more rural areas, and less growth in the north and northeast. So hopefully what we're going to see in the next weeks, months, is that the growth rate in the U.S. will start to level off and look more like it does in Belgium. But it hasn't yet. This is still a growing pandemic in our country. It is especially growing in more rural areas and the places that weren't hit initially. So it remains extremely important that we continue to do the things that we know make a difference in controlling this pandemic. There's a great deal more information about COVID-19 on the College of Public Health website. If you go and click on this link, you can see a variety of videos that we've recorded. If you know anyone who'd like to be added to our mailing list, please let Jan Stork know at her email address or this phone number. And if you have any questions or comments, please let me know. I like to hear from folks. I'd like to know whether these videos are helpful to you. And if you have any questions or you'd like to see us cover a particular topic, please let me know. I look forward to hearing from you. Thanks a lot.